Ximino is a medication used to treat moderate to severe acne in people 12 years and older. It helps to reduce the number of pimples by stopping the growth of bacteria that may make acne worse. Ximino belongs to a class of drugs known as tetracycline antibiotics and treats acne that is thought to be caused by a bacterial infection. It will not work for viral infections, such as the common cold or flu. It's important to only use Ximino when it is needed to avoid it not working for future infections. The daily dosage and optimal timing for taking Ximino should be determined by a healthcare professional. Before taking Ximino, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with or without food, usually once a day as directed by your doctor. Swallow the medication whole with a full glass of water, and do not lie down for at least 10 minutes after taking it. You may take this medication with food to lessen the chance of irritating the esophagus or stomach unless your doctor directs you otherwise. Take this medication 2 to 3 hours before or after taking any products containing aluminum, calcium, iron, magnesium, or zinc, as these can prevent your body from fully absorbing the drug. The dosage and length of treatment will depend on your medical condition, weight, and response to treatment. For the best effect, take Ximino at the same time every day. It's important to continue taking the medication for the prescribed length of time and not to skip doses. If your condition does not improve or gets worse, make sure to consult your doctor. Side effects of Ximino may include nausea, vomiting, diarrhea, lightheadedness, dizziness, or a feeling of spinning. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any of the following serious side effects: painful/difficult swallowing, changes in hearing, joint stiffness/pain/swelling, signs of kidney problems, signs of liver problems, yellow-gray-brown tooth discoloration, or blue-gray skin/tongue/lip/gums. Women of childbearing age who are overweight or have had intracranial hypertension in the past are at greater risk of experiencing increased pressure around the brain, intracranial hypertension (IH), as a rare side effect of minocycline. If you experience severe or lasting headache, vision changes, or nausea/vomiting that doesn't stop, seek medical help immediately. Ximino may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool, contact your doctor right away. Prolonged or repeated use of Ximino may result in oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. While a serious allergic reaction to Ximino is rare, seek medical help immediately if you experience symptoms such as fever, new or worsening lymph node swelling, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. Remember, do not use anti-diarrhea or opioid products if you experience symptoms of a severe intestinal condition due to C. difficile. If you are in the US, call your doctor for medical advice about side effects. You may also report side effects to the FDA. In Canada, call your doctor for medical advice about side effects and report them to Health Canada. This product may contain inactive ingredients, which can cause allergic reactions and other problems. Before using Ximino, tell your doctor your medical history, especially of kidney or liver problems, trouble swallowing, and esophagus problems. Ximino may make you dizzy, so avoid alcohol or marijuana, which can make you more dizzy. Also, limit your time in the sun and wear protective clothing when outdoors, as this medication may make you more sensitive to the sun. Before having any immunizations or vaccinations, inform your healthcare professional that you are using Ximino. Children younger than 8 years may be more sensitive to the side effects of Ximino, especially tooth discoloration. Tooth discoloration has also occurred in older children and young adults. If you are pregnant or plan to become pregnant, you should not use Ximino as it may harm an unborn baby. This medication also passes into breast milk, so consult your doctor before breastfeeding. When taking Ximino, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ximino include retinoid medications taken by mouth, such as acitretin, isotretinoin, and strontium. Additionally, Ximino may interfere with certain lab tests, such as urine catecholamine levels, which could potentially cause false test results. Make sure lab personnel and all your doctors are aware that you are using this drug. As for the best way to take Ximino, it is typically recommended to take it once daily with food. It's important to follow the dosage instructions provided by your doctor. If you or someone else has taken too much Ximino and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It's important to note that Ximino should not be shared with others and should only be used for the current condition it was prescribed for. Your doctor may also conduct lab and/or medical tests while you are taking this medication, so it's crucial to keep all medical and lab appointments. If you forget to take a dose of Ximino, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Ximino at room temperature, away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. When it's expired or no longer needed, make sure to properly dispose of it. Never flush it down the toilet or pour it into a drain unless instructed to do so. If you have any questions about how to properly dispose of Ximino, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.